Hello to everyone and welcome to another episode here with Hypnotherapy Training International and Dr. John Butler, and today's topic is arm levitation. You might have seen it on television or on YouTube and it may look weird to some of you, may look cool to others. Dr. John Butler, perhaps you can tell us a little bit about arm levitation in just a few minutes, where it came from, what it uses in therapeutic settings.
Thank you, Idan. Again, a very brief overview. It's another off-the-cuff interview. Arm levitation has been around for a long time in therapy, and it's used. It's what's called the suggestibility test. A much better word for this would be responsiveness training or even imagination training, because it fulfills the function of helping the person learn to use their imagination, in this case, to move a body part, to move their arm. Now, when you learn to do that, you can also learn to use imagination to affect other functions within the body. You're starting to learn mind-body control at quite an effective level, even at a very early stage, even with such a simple exercise. Now, as you learn to use that power of suggestion, you can give suggestions for other goals in life. Maybe you need to use suggestion to help yourself give up smoking, or to become a better pianist, a piano player. You can use suggestion for so many things. So this is one of the first steps in learning to use the power of suggestion. Now, it also allows the therapist to find if there's any problems, inhibitions on response, and deal with them, whether there's over control, fear of losing control, really, which this is the basis of that, or other problems that are there. So it can be very helpful diagnostically. When the person responds well to that suggestibility exercise, responsiveness exercise, then it helps us to convince them that they can respond, because it's not something they've experienced before. Many clients will say, "Oh, that's amazing. I didn't expect my arm to rise. And when it did, I felt I wasn't really controlling it." So they're learning the principle of non-voluntary action. The old Chinese philosophy, it was called Wu Wei. And so learning to communicate with your subconscious in this basic way and then taking it further. Now, of course, there's other aspects of this that are complex. The relation between responsiveness to suggestion and adaptive trance, or the ability to go into trance, but that's very complex and is a subject of a lot of debate academically. But from a practical point of view, we're not that interested in it right now in the clinical setting. The complexities of that debate, at least. What normally we can say is, when the person is confident that they can have that movement, non-voluntary movement, and learn to develop it more and more, it does open the door, both in confidence terms, that they'll respond to you further along with other suggestions, and allowing themselves to go into the trance. So if it's explained well, used well, it does help to develop their trance ability as well. A big complex topic, of course. So there are many very positive uses of that test. And one of the biggest ones is simply to convince the person that they're responding without it simply being, "Oh, I am doing this just to humor the therapist, and I'm not really responding hypnotically." Because the hand comes up in such a manner that they feel they're not controlling it. It is a great convincer that you're a good therapist, that they're able to respond, and this really sets the scene very often for some good progress in dealing with their clinical issues.
John, thank you so much for that. And for those of you listening, if you would like to check John 4 different levels of arm levitation, you can have a look at hypnotherapytraininginternational.com under the courses section, starting with self-hypnosis, the hypnotherapy skills for life change, progressing to clinical hypnotherapy, which so the self one will teach you to arm levitate, the second one, the clinical, will teach you how to work with clients, and the advanced analytical to work maybe on deeper levels of suggestions and tests and relaxation techniques, and the last one, the medical hypnotherapy, where you learn to take your trance and your hypnotic suggestions to the highest level that I know, at least. So thank you so much again, Dr. John Butler, and for those listening at home.
Thank you, Idan. Thank you, the listeners.